And toxic stress training. Today we're going to be talking about toxic stress and really getting into some of the meat around how toxic stress plays out. My name is George Yagatic, and I am the training and engagement facilitator here at the California Health Collaborative. I'm really excited to be here. We have some a good turnout from the Central Valley region, and I'm excited to see you all joining us today. Just a couple housekeeping notes. This webinar is being recorded. Slides will be made available at the conclusion of our event today. Please keep your microphone on mute. However, in terms of questions, we like to keep this a dialogue. If something comes up, please unmute yourself, ask your question, and we will get those out as quickly as possible. We will have questions available at the end of the session, so if you prefer, make a note, ask your question at the end of the session. We will have a few minutes to go over some of the content that we have discussed. We've got a lot to bring you today, both on toxic stress, referrals, and adverse health experiences. If you're having issues connecting with this webinar, please call in and mute your phone. As I had mentioned, make sure your name and your organization is in the chat feature. And lastly, check your Zoom name and ensure that it has the correct name to identify you. As I had mentioned about questions, we encourage that you make this a dialogue and bring whatever comments, questions, or concerns that you have along the way into either the dialogue, the chat box. You can make comments as we go along. Questions will be highlighted and brought to our attention if you put them in the chat box, or you can unmute and ask them directly. So we want to, again, make this an open feature, keep you engaged and keep you part of the discussion as we move forward. ACEs Aware Kings collaboration with funding from ACEs Aware is a collaboration of California Health Collaborative, the Kings County Department of Public Health, Kings Partnership for Prevention, and Kings United Way. We very much appreciate the work of all of our partners who have committed to moving this work forward to improve the health and well-being of individuals, families, and the communities in which we live. At this point, I would like to take a moment and just have our collaborators introduce themselves. And as I have already done, I'd like to start this off with our program manager, Linda Baggio.
Good morning, my name is Linda Baggio. I'm the program manager here at the California Health Collaborative, and we're very happy to have you all here. And I will pass it on to Karina.
Good morning, my name is Karina, and I am the office administrator for Kings Partnership. And Cameron?
Good morning, everyone. My name is Cameron, and I'm the communications coordinator for Kings Partnership. I'm going to pass it to Lexi.
Good morning, everyone. My name is Alexis Terrell. I am the community engagement manager for Kings United Way. Erica?
Thank you. My name is Erica Lopez, and I'm the content coordinator at Kings United Way.
And Erica, if we could just get a microphone check. I know you're presenting a little bit later. I want to make sure that you're up to speed. Your microphone seemed a little bit muted. Can you just give us a quick check one more time?
Yeah, can you hear me?
It's a little better, yeah.
Okay.
Awesome, thank you so much. So as I had mentioned before, these are our collaboration partners, and they do an awesome job. They just do a wonderful job with the work that we do here in Kings County. We would also like to take this moment to familiarize you with the leaders of the ACEs Aware initiative. ACEs Aware is the initiative that is led by Dr. Nadine Burke-Harris, California Surgeon General, and Dr. Karen Mark, Medical Director of the Department of Healthcare Services. It offers Medi-Cal providers training, screening tools, clinical protocols, and payment for screening children and adults for adverse childhood experiences. Screening for ACEs, assessing risk for toxic stress, responding with evidence-based interventions, and trauma-informed care can significantly improve the health and well-being of families. The California Surgeon General has set a bold goal to cut ACEs in half in one generation. And this effort is part of Governor Newsom's California for All initiative. Their mission is to change and save lives by helping providers understand the importance of screening for adverse childhood experiences and training providers to respond with trauma-informed care to mitigate the health impacts of toxic stress. So to kick us off, I'd like to share a short video from Dr. Nadine Burke-Harris. Oops. My bad, I'm sorry about that.
George, we can't see the screen.
I'm sorry, Linda, what was that?
You have to share. We cannot see. You don't have a shared screen with us.
Ah. Are we back to shared screen?
Yes.
Yes, okay, thank you. And let me make sure that I've got the good to share sound is down. All right, here we go.
Let's start with some numbers. Adverse childhood experiences, or ACEs, affect 2 out of every 3 Californians. Without intervention, they can lead to toxic stress, creating long-term physical, mental, and behavioral risks for your patients. 9 out of 10 of the leading causes of death in the U.S. are associated with ACEs. And for communities that face higher levels of adversity, toxic stress can further perpetuate health inequities. That's why the Office of the California Surgeon General and the California Department of Healthcare Services have developed ACEs Aware, a program that gives providers like you the power and support to screen for and respond to ACEs and toxic stress, improving your patients' health now and in the future. The #1 thing that you can do to help your patients is early detection and evidence-based treatment. It all starts by becoming ACEs Aware. Sign up for the 2-hour online training and learn how to screen for adverse childhood experiences and how to recognize and respond to the symptoms of toxic stress with interventions supported by science. By screening for ACEs and applying the principles of trauma-informed care in your practice, you can help California cut ACEs and toxic stress in half in a generation. Join us to make a difference. Go to acesaware.org to get trained today.
Excellent. Thank you, Dr. Nadine Burke-Harris. Okay, so let me just go ahead and adjust this as we move forward. Take just a moment to, there we go. All right. So let's dive right into toxic stress. Today, we're going to be focusing on toxic stress and what to do as we encounter that in terms of referrals and interventions. We lead off today with the overwhelming scientific consensus that upstream factors, including adverse childhood experiences, toxic stress, and social determinants of health, are the root cause of many of the most harmful and persistent health challenges, from heart disease to homelessness. We now understand that a key mechanism by which ACEs lead to increased health risks is through a health condition called the toxic stress response. When significant adversity is experienced during critical and sensitive periods of early life development without adequate buffering protections of safe, stable, and nurturing relationships and environments, it can lead to prolonged activation of the biological stress response and to long-term disruption of neuro, endocrine, immune, metabolic, and genetic regulatory mechanisms. These biological changes can be transmitted to the next generation. High doses of cumulative adversity experienced during these critical and sensitive periods of early development without adequate buffering protections of safe, stable, and nurturing relationships and environments can become biologically embedded, and that's important to recognize. The subsequent biological changes are known as the toxic stress response, which refers to prolonged activation of the stress response system that can disrupt the development of brain architecture and other organ systems, and increase the risk for stress-related diseases and cognitive impairment well into the adult years. While the term toxic stress was originally coined by the National Scientific Council on the Developing Child to describe the developmental changes associated with prolonged adversity in a policy context, it is now recognized that the accumulated changes to the physiologic stress response system, as well as brain and other organ systems development, represent a health condition with clinical implications. These changes include disruption in brain development and function of the neuroendocrine immune metabolic axes, acting through epigenetic or genetic regulatory mechanisms that can be transmitted to the next generation. The stress response system. Let's take a deeper look at our stress response system. Stress is defined as real or interpreted threat to the physiological or psychological integrity of an individual, which results in physiologic and or behavioral responses. Stressors include experiences as diverse as navigating a new environment, running a marathon, witnessing violence, or enduring a physical injury. The body reacts to stress via a complex process of physiological and behavioral adaptation known as homeostasis, which allows biology to remain within physiological parameters necessary for life. An example of homeostasis is the activation of perspiration and thirst as the body temperature rises on a hot day. These responses serve to cool the body and maintain temperature within a preset normal range. A stressful situation, whether something environmental, such as a looming work deadline, or psychological, such as persistent worry about losing a job, can trigger a cascade of stress hormones that produce well-orchestrated physiological changes. A stressful incident can make the heart pound and breathing quicken, muscles tense, and beads of sweat appear. Unfortunately, the body can also overreact to stressors that are not life-threatening, such as traffic jams, work pressure, and family difficulties. So let's break down the stress response so we can see how it plays out in different ways. The biological stress response has been characterized into three types: positive, tolerable, and toxic. So let's start with positive, because not all stress is bad. Some stress is a necessary and even essential part of growth and development. It can help us transiently mobilize energy and increase focus to perform better at the task at hand, such as upcoming task, the big game, or even a presentation like this. The positive stress response is characterized by brief elevations in stress hormones, heart rate, and blood pressure in response to a routine stressor. Now, tolerable stress, a little bit larger, a little bit more intense. It activates the body's alert systems to a greater degree as a result of more severe, longer lasting difficulties, such as a frightening injury, the loss of a loved one, and natural disaster. If the activation is time limited and buffered by relationships with adults who help the child adapt, the brain and other organs recover from what might be otherwise damaging effects. So toxic stress. Toxic stress is defined by the National Academies of Science, Engineering, and Medicine as prolonged activation of the stress response system that can disrupt the development of brain architecture and other organ systems and increase the risk of stress-related disease and cognitive impairment well into the adult years. So for children, the result is disruption of the development of brain architecture and other organ systems and an increase in lifelong risk of physical and mental health disorders. But how do these long-term disruptions occur? This is important, and I think really the key to understanding toxic stress. The term allostasis was developed by McEwen and colleagues in recognition that certain circumstances result in physiological adaptations that result in new biologic set points that may be temporary or permanent. An example of allostasis is the many hormonal and physiologic changes associated with lactation when an infant is born. In response to the birth of a child, the mother's body establishes and maintains a new biologic set point necessary for supportive milk production and infant feeding. The energy required to achieve allostasis is known as allostatic load. As the crucial concept in this field, when the stress response is activated too frequently, too intensely, or chronically, allostasis may occur, resulting in new biologic set points being wired as an adaptation to respond to stressful environments. The stress response, which is life-saving when activated in the short term, as in most organisms, becomes health damaging when activated chronically, producing a state of pathological heavy allostatic load. For example, in the short term, stress hormones increase blood pressure, which can bring greater blood flow to muscles to save an animal sprinting for its life. But when activated chronically, it can lead to increased wear and tear on blood vessels and damage to the cardiovascular system. Any comments here with regard to allostatic load? I think that's an important concept to really hold on to in understanding toxic stress and how that plays out physiologically. Okay, let's take a look at a short video to see how toxic stress affects our physiology.
Learning to deal with stress is an important part of healthy development. When experiencing stress, the stress response system is activated. The body and brain go on alert. There's an adrenaline rush, increased heart rate, and an increase in stress hormone levels. When the stress is relieved after a short time, or a young child receives support from caring adults, the stress response winds down and the body quickly returns to normal. In severe situations, such as ongoing abuse and neglect, where there is no caring adult to act as a buffer against the stress response stays activated. Even when there is no apparent physical harm, the extended absence of response from adults can activate the stress response system. Constant activation of the stress response overloads developing systems, with serious, lifelong consequences for the child. This is known as toxic stress. Over time, this results in a stress response system set permanently on high alert. In the areas of the brain dedicated to learning and reasoning, the neural connections that comprise brain architecture are weaker and fewer in number. Science shows that the prolonged activation of stress hormones in early childhood can actually reduce neural connections in these important areas of the brain at just the time when they should be growing new ones. Toxic stress can be avoided if we ensure that the environments in which children grow and develop are nurturing, stable, and engaging.
Okay, so toxic stress and how to bring it back down to tolerable stress really require those nurturing and stable relationships. Again, an opportunity here to chime in with any comments about tolerable toxic stress and the difference between the two. I really like the concept of allostatic load, how tolerable stress can become toxic stress as it accumulates over time and maintains itself, moving that allostatic load up into a biologic set point. I'd like to bring in here the idea of the damage that toxic stress plays out and some of the top 10 leading causes of death. A consensus of scientific research demonstrates that cumulative adversity, especially when experienced during critical and sensitive periods of development, is a root cause of some of the most harmful, persistent, and expensive health challenges facing our state and nation, including 9 of 10 of the leading causes of death in the United States. The leading causes of death in the US are overwhelmingly the result of chronic and preventable disease. Nearly 75% of all deaths in the US are attributed to 10 causes, with the top 3 of these accounting for over 50% of all deaths. According to the CDC and prevention, the top 3 causes of death in the US in 2016 were from heart disease, cancer, and unintentional injuries. Within the 4-county region here in the Central Valley, cancer and heart disease occupy the first and second spots for leading causes of death from 2011 to 2016. Kings County has the highest rate for mortality from all cancers at 152.2 per 100,000 rate for mortality from all cancers. During the same period of time, the mortality rate for all cancers in California was 140.2 per 100,000. Closer examination of heart disease mortality rates revealed that Tulare County has the highest rate, age-adjusted rate at 120.5 per 100,000. That's age-adjusted. The state's heart disease mortality rate was 89.1 per 100,000. And notably, all counties surpassed the state average for this indicator. The 3rd, 4th, and 5th, and 6th causes of death in the region varied by county in terms of order. However, for each county, these ranking were comprised of mortality rates for stroke, accidents, unintentional injuries, Alzheimer's disease, chronic lower respiratory illness. The 7th leading cause of death across all counties is attributable to diabetes mortality, with the highest rate found in Tulare County at 26.5 per 100,000. Comparatively, the average for the state of California during the same time span was 20.7 per 100,000. Notably, all counties surpassed the state average for this indicator. Finally, the 8th, 9th, and 10th leading causes of death in the region varied by county in terms of order. However, for each county, these rankings were comprised of mortality rates for drug-induced deaths, influenza, pneumonia, and chronic liver disease and cirrhosis. So what we are looking at here, this is the ACEs and toxic stress risk assessment algorithm, the ADA version. It will help you assess whether a patient is at low, intermediate, or high risk of toxic stress physiology. How do we put this together? We have the ACE screening, we have the ACE score, we have our symptomology, our diagnosis, associated health conditions, and what do we do? How do we put those 3 things together? And I think this is really the crux of utilizing the ACE screening score with what is going on with the patient. The algorithm's toxic stress risk assessment is based on a combination of both the ACE score and the presence or absence of ACE-associated health conditions. ACE screening involves assessing for the triad of adversity, ACE score, clinical manifestations of toxic stress, AAHCs, and protective factors. The first 2 components are used in assessing clinical risk for toxic stress, and all 3 help to guide effective responses. Of important note, there currently exists no widely agreed upon clinical diagnostic criteria for toxic stress. The toxic stress response is not listed in the internal classification of disease. Although the biology mechanisms of toxic stress are well supported by a consensus of scientific evidence, further research is necessary to determine whether the toxic stress response is best characterized as a condition, a disorder, or a disease. In the absence of clinical diagnostic criteria, the combination of ACE score and the presence or absence of AAHCs, health conditions, may serve as a somewhat crude but useful proxy for the likely presence of a toxic stress response. Pending the development of confirmatory diagnostic criteria and/or biomarkers, the evidence supports characterizing a patient as being at low, intermediate, or high risk of manifesting a toxic stress response. The ACEs and toxic stress response assessment algorithm for pediatric and adult care was created by a team of expert researchers and clinicians led by the Office of the California Surgeon General to assist providers who screen for ACEs in assessing risk for toxic stress. The healthcare setting offers a unique opportunity to help patients and families understand the impact of ACEs on health and to prevent and treat toxic stress. ACE screening involves assessing for the triad of adversity, clinical manifestations of toxic stress, i.e. ACE-associated health conditions, and protective factors to assess clinical risk for toxic stress and to guide effective responses. Of note, though clinical manifestations of the toxic stress are currently best addressed by the presence or absence of AHCs, efforts are underway to develop more reliable clinical biomarkers that may inform diagnosis, prognostic precision, and therapeutic targets in identifying and intervening on toxic stress. Robust evidence demonstrates that enhancing supportive relationships, regular exercise, access to nature, sufficient and high quality sleep, balanced nutrition, mindfulness practices, and mental and behavioral health care can mitigate the neurologic, endocrine, immune, metabolic, and genetic regulatory derangements of the toxic stress response. Clinical response to identification of ACEs and increased risk of toxic stress should include identification and treatment of ACE-associated health conditions by supplementing usual care with patient education on toxic stress and strategies to regulate the stress response by addressing the protective factors, which include what you see in front of you. The 7 stress busters are put out by Dr. Nadine Burke-Harris and the ACEs Wear are listed here. So just to run through these, I think these are pretty common sense in many ways, but when you take a look at them as a whole and remember to keep in mind these interventions and how they help reduce toxic stress, you can alleviate, you can reduce toxic stress. So in terms of balanced nutrition, we try to eat fresh whole foods and avoid processed foods or foods with a lot of sugar. Shop from the outside of the store. Make sure you drink 8 glasses of water a day. Mindfulness practices. Take a few minutes to sit quietly every day. Notice your breath, feel the floor beneath you. Have a spiritual practice. Physical activity. Get at least 30 minutes of gentle exercise every day, including walking, swimming, or biking. Include weight-bearing exercises in your routine. Both strength and cardiovascular training are important. Quality sleep. Try to get 8 hours of sleep every night. Cut down on your use of caffeine, especially in the afternoon. Create a bedtime routine for yourself and your children. Don't take the phone to bed with you. Supportive relationships. Practice good, honest, and open communication. Spend quality time focused on those you love. It doesn't need to be expensive. Be creative. Do or say something daily to show appreciation to those you care about. Mental health care, very important. See a therapist to discuss quality of life issues. Early warning signs of mental health issues can include trouble sleeping, pulling away from usual activities, feeling helpless, and unexplained aches and pains. And lastly, and one of the most newest areas to be added to the Stress Buster wheel, access to nature. Take time each day to get out into nature, walk barefoot on the grass, garden, or simply get some sun on your face. Nature is an essential to overall health, and we often forget this. And here in the Central Valley, it's so accessible to us. It should be part of our daily routine. So there is hope. Toxic stress is amenable to treatment. We can act now to change and save lives. We can screen for ACEs and toxic stress risk. We can intervene early, respond with evidence-based trauma-informed care, and significantly improve the health and well-being of individuals and families. These efforts can also reduce the risk of intergenerational transmission of ACEs and toxic stress. So these interventions may seem common sense, may seem like things we should think about on a regular basis, but they do a lot. So at this moment, we like to take a mindfulness moment. Take a nice deep breath. And as your exhale slowly releases, I want you to think about the period of time between your inhale and your exhale. Lengthen that just a bit. We'll take a nice deep breath. We'll pause and exhale. Make sure your exhale is longer than your inhale. So what we're going to do is a short mindfulness exercise here, an exercise that you can do with your patients right there in your clinic, in the room, as an example to show how you can bring down that toxic stress response. Very easy, very simply, exhaling longer than your inhale. So take a nice deep breath, a 4-count inhale. Let's inhale at 1, 2, 3, 4, pause. Exhaling at 1, 2, 3, 4, 5, 6. Pausing, take an inhale at 1, 2, 3, 4, pause. Exhaling at 1, 2, 3, 4, 5, 6. Take a nice deep inhale here. And release, exhaling, feeling that exhale go longer than the inhale. This simple exercise can be utilized to reduce stress, to introduce people to breathing exercises, and to get somebody to understand how you can reduce some of the effects of toxic stress. Mindfulness exercises can help turn the stress response down. It's easier to be mindful in your everyday life when you practice regularly. And so we offer these exercises as a way to demonstrate our practice and how you can utilize this simple exercise in your examination rooms with your patients, and in a short 1 or 2 minute opportunity to show them how important simply breathing and reducing that toxic stress response can be. As I end here, I'd like to look at a case study. Not every clinic has the staffing resources to provide a high level of team-based care. However, in these instances, there are resources in the community that may be able to share in the responsibility for care coordination, such as managed care plans, IPAs, and family resource centers. Knowing a patient's ACE score can inform a more comprehensive management strategy for health conditions associated with adversity. 40% of the patient population at UCSF Benoit Children's Hospital, Oakland, have a diagnosis of asthma. Given that ACEs can lead to stress and that asthma is a disease of inflammation, providers target therapy to reduce the inflammation by four ways: partnering with community health workers to help address unmet basic needs like food, access to nature, and housing; providing patient education about high quality sleep, nutrition, physical exercise, mindfulness, mental health, and supportive relationships; increasing and encouraging compliance with medical management, such as inhaled corticosteroid controller medications. Similar advice can be given for management of enuresis, to obesity, to learning issues. And finally, engaging mental health colleagues as appropriate to work with the patient family when concerned about anxiety, depression, and or behavioral concerns. This type of comprehensive team-based care enables clinicians to focus on providing buffering supports, promote resilience, and manage the health conditions simultaneously. But how do we find those referral sources that provide these evidence-based interventions? This is what our next speaker will be discussing. So at this point, I'd like to turn it over to Kings United Way. Erica, if you'd like to step up and introduce yourself.
Thank you, George. Can you guys hear me, or can everyone hear me?
Yes, that's much better. Thank you for checking.
Awesome. So good morning, everyone. As mentioned earlier, my name is Erica Lopez. I am the 211 coordinator at Kings United Way. Included in this effort, we have Executive Director of Kings United Way, Nanette Villarreal, and we also have Alexis Terrell, Community Engagement Manager, who will be going over the Kings County Referral Exchange. Next slide, please. So I will be presenting on 211 Kings County, and you will hear from Lexi in just a few minutes on the Kings County Referral Exchange. Next slide, please. Okay, so ACEs Aware recommends connecting patients to a network of care to support the treatment of toxic stress through the evidence-based interventions for mitigating toxic stress. 211 is an important resource for Kings County Network of Care for responding to ACE screening and mitigating the toxic stress, connecting patients to both social services and resources to address toxic stress. Through 211 Kings County, patients can be connected to resources to reduce toxic stress, and they can also be connected to resources to support social needs, such as housing, utilities, transportation, households, and much more. Through 211 Kings County, you can find some resources that help support the items in the Stress Buster Wheel. For resources that help with supportive relationships, those resources can be found under the family category on our website and the mobile app. Resource information to support balanced nutrition can also be found in the food category. And you can also find information on mindfulness practices in our health category. And of course, we have information that help with mental health care and mental health in the mental health category and addictions category. Next slide, please. Okay. So 211 is, it aims to bring organizations in the community together to better serve residents of Kings County. So in July 2000, the Federal Communications Commission assigned the 3-digit dialing code 211 for the exclusive purpose of providing widespread access to community information and referral services. 211 allows you to access information in our database on community resources such as food, substance abuse, mental health resources, and much more. So we have 5 different ways you can access 211. And you can access those 5 different ways, either by dialing 211 to find local resources in Kings County. So when you dial 211, it links callers to a call specialist. Call specialists can provide information on local agencies providing services in Kings County. So resource information can be given over the phone or texted to a caller. And it can also, in the call, when you dial 211, we also offer follow-up calls to ensure that a caller was able to get connected to resources provided and to provide any additional information on resources. Clients can also text zip code to 898211 to receive information on resources. And as mentioned earlier, we also have a website. It's called 211kingscounty.org, where you can search by category or search by text or chat with a call specialist through live chat. You can also search for local resources in our database by downloading our mobile app 211 in telephone, and that mobile app is available in both English and in Spanish. And all 211 services are able to be reached 24/7. Next slide, please. So through the 211 Kings County website, patients can search for resources in our 211 Kings County database by searching by category or searching by text. In case there's some trouble finding resources, we also have live chat available 24/7. So when you visit 211kingscounty.org, information you receive on programs is description of a service, as well as website link, phone numbers, location, hours of operation, and program delivery, such as eligibility requirements, application process on programs, program fees, and any documents that are may be required for a program. Next slide, please. So key organizations providing ACE resources and services are able to provide information to me and my team to add to the database to better serve clients in need of resources. So just a reminder, we do have 211 Kings County cards available in both English and in Spanish. If you're interested in providing 211 Kings County cards to your patients, please let me know. I'll have my contact information in the chat box. And we also have 211 Kings County posters available in both English and in Spanish. But just, I wanted to go over an example of of how 211 works to give you a better idea. So before I close out my presentation, I like to go over that. So let's say, for example, we have a patient, a 40-year-old patient looking for access to benefits because he was let go from his job and is seeking, let's say, mental health services. Not having a job is causing him a huge amount of stress. In order to help his stress come down and have a healthier mindset, he knows he wants to find resources. So he remembers seeing a 211 Kings County poster at the clinic he goes to. Eric knows he can find resources on the 211 website. So he visits 211kingscounty.org and browses around for resources. Since he lost his job, he is able to find information on local resources in Kings County that help with job assistance in the income category. Eric has also had, let's say he's looking for, either substance abuse resources or mental health resources. He can find all of that information under the mental health category, as well as the substance abuse category available on our website. But just in case, let's say, for example, Eric does not have access to internet and he is unable to access a computer. In Eric's case, we know he lost his job and is looking for support, right? So he calls 211 and lets the call specialist know what kind of help he is seeking. Call specialist then gives information to Eric on local agencies that can help him find as well a job assistance office close to him, as well as support, let's say, for example, like a support group at a local church. So during the call, Eric agrees to a follow-up to ensure resources provided were helpful. And that at that time, when Eric had agreed to the follow-up, then me and my team go ahead and reach out to Eric to see if he was able to access all of the resources provided. In Eric's case, let's say during the follow-up, Eric mentioned it's been tough to keep up with everything since losing his job. At that time, we can offer information on, local food resources, the closest food distribution in his area in Kings County, as well as, let's say, for example, rent assistance and utility assistance. So all in all, he's able to find different resources either by calling, visiting the website. Again, we have different ways to access 211. So he will be able to find all of that information on there. And so it can be helpful to have these 211 Kings County brochures as well as posters to give information to the community on not only resources that help support social needs, but as well as resources that can help mitigate toxic stress. Next slide, please. Okay, at this time, I'd like to open it up for questions or any comments. Okay, no questions, no comments. I would like to go ahead and turn it over to Lexi. Thank you.
Thank you, Erica. Again, my name is Lexi Terrell. I am the Community Engagement Manager for Kings United Way. On this call to support me today is Kendra DeBajian from Unite Us. So if you have any more questions about the platforms, you can chime in. 211 is an amazing resource and is something many of us have probably used for our clients or ourselves as a self-help resource. The referral exchange will supplement the efforts of 211 by becoming a database for providers that enables you to send referrals to other organizations on the platform for your client to get connected to appropriate resources that help reduce toxic stress and address any needs the client has. Built-in screeners such as the ACEs screener and the ability to download reports make the referral exchange a versatile tool to support our organizations and our community. Now let's take a look at what a client profile will look like on the Unitas platform. Next slide, please. Erica talked about Eric's experience with 211. He was able to get some information to get him to services he needed. Since he lost his job, he needed to get benefits to get some mental health services. So the first referral being sent for him from the Unitas platform is to get to an organization that helps with benefits eligibility. All service locations are geotagged to be able to get the client to a resource that is close to them and shouldn't require any special transportation. Once the referral is sent out, that organization gets an email notification that a referral is waiting. Then they can go in and accept the referral and get Eric to services much faster than having him on a wait list. The client can choose to get email or text notifications when the referrals are accepted, so no one falls through the cracks of care and everyone in his care team stays up to date. Next slide, please. The core components of a referral exchange include a network of partners, shared language, a resource database, and bidirectional referrals, and a technology platform integration. All these come together to create a community care plan. Under guidelines offered by the ACEs Aware initiative, the RE system works to offer patient-centered workflows, cloud-based solutions, core security and compliance principles, a single person history and identifier with capability to match across platforms, standardized structured data capture, alignment with industry-wide data and interoperability standards, and modern application programming interfaces. With the ACE Aware Trauma-Informed Network of Care's second round of funding, Kings United Way is honored to be a partner to expand our investment in the RE platform to continue the facilitation of connections across multiple agencies that links patients and their families to needed services. The expansion of funding to create this system will also allow for seamless, secure, closed-loop referrals across the ecosystem of partners. For more information on the expansion of the IT infrastructure under the ACEs Aware, please take a look at the ACEs Aware Network of Care roadmap. I'll be including it in the chat. Next slide, please. By using the Unitas platform, the Kings County Referral Exchange creates a community-wide referral system through connections made across multiple agencies and links patients and their families to needed services. The resource database helps you find information on participating agencies and enables you to start the closed-loop referral process. The closed-loop referrals are sent and either fulfilled or returned back to the originating organization if the program is full or is no longer funded. Email notifications make sure that no one falls through the cracks of care. Sharing client-level data protects the client from having to tell their story more than once. And any changes to the contact or content of the client data is automatically updated platform-wide. Next slide, please. Here are upcoming sessions for you to learn more about the Unitas technology platform. Information sessions cover how it can be used and how your organization can join. If these dates and times don't work for you, please reach out to myself or Kendra to schedule a session that works best for you and your organization. Thank you for your time. And if you have any more questions or want more information about the referral exchange or 211 Kings County, please reach out to myself, Kendra, or Erica. And I'll provide information in the chat. Thank you again.
Okay, thank you, Lexi, and thank you, Erica. I really appreciate you sharing your knowledge of 211 and the referral exchange with us today. Thank you so much. I'd like to open this up and talk a little bit about hurdles, problems, and struggles that you've had with referrals when you do encounter somebody who you'd like to consider as somebody who might have toxic stress issues, how might you reduce that symptomology? What kind of interventions might you offer? And what are the hurdles to offering those interventions? What we shared here today is that 211 and the referral exchange are two options. And I'm wondering if those have come up in your practice before, or what generally does come up in your practice if you are considering stress busters.
George, this is Patty Haver. I really appreciate the information regarding to the 211 Kings County and also the referral. I know for myself, I guess my question here is, if a client who is known to have toxic stress and you want to refer, do you have to be a Kings County resident to utilize Kings County resources, the 211?
That's a great question, Patty. Thank you so much. I'm going to refer that over to Erica. Erica?
Yes, Patty, thank you so much. So it just depends on the program eligibility requirements. So for 211 Kings County resources, our 211 Kings County database, we have a lot of our 211 Kings County resource, and we do have some resources in the database that can be Tulare resources, but that serve Kings County. So it just really depends on the program requirements.
Thank you, Erica. I appreciate that. Patty, I hope that answered your question.
Thank you.
Absolutely. So I'd like to hear from some other people in terms of the engagement with your patients, with your clients around interventions, around stress buster interventions. What are some of the things that have worked, and what are some of the things that have not worked? Have you tried 211? Are you aware of Unite Us? Just a couple things to think about. Love to hear back from you. And we also have two people who are on the phone who are calling in. And I just wanted to acknowledge them because you have not had the opportunity to put in the chat feature an introduction. So if you'd like to chime in and give us some feedback on referrals, on where you get your information for stress buster interventions.
Hi. Excuse me. Hi, this is Tracy Slack. Forgive my raspiness. I wanted, maybe I missed this, but is there an app that can be downloaded on a phone that people can always have access to 211, or see a comprehensive list of services that may be offered?
Yeah.
Erica?
Yeah, so Tracy, we have a mobile app that you can access information from our database. And the mobile app is called 211 IntelliFull. And so it's going to be very similar to the website. It has different categories available. Like our website, it has food categories, substance abuse category, mental health category, housing. So it has a wide range of different categories. It's just, like you mentioned, help at your fingertips. It's a mobile app. So yes, it's called 211 IntelliFull.
Thank you so much.
You're very welcome, Tracy. And when you click on a category, it does guide you to a page that gives you a list of subcategories. So for example, you click onto the mental health category, it will then give you a list of subcategories, for example, like support groups or hotlines and things like that.
Awesome. Thank you.
You're welcome.
We just have a couple more minutes left here at our peer-to-peer session. And again, part of this is about connecting, is about sharing what our best practices are, what our successes, and sharing some of those things that don't work as well. There are two people on the phone, and I'm not sure if we've had the opportunity to introduce ourselves. I want to get the people on the phone an opportunity to do just that. So if you could unmute yourself and just make a quick introduction and share a little bit about your name and the organization that you're with, that would be greatly appreciated. I have the last 4 digits of 7917 and 7936. We're calling in.
Good morning, everyone. This is Master Sergeant Diana Galpin. I've been listening in to all the information that you guys have been giving, which is amazing. My organization is the Counter Drug Task Force, and I work in the field of prevention. So all of the resources that you guys have been explaining today have been super useful for when I go out into the field and I meet people that are looking for these resources. I find myself being as a hub of information, and is why I sit in on a lot of these meetings, so that I can provide those resources through my network. So thank you for everyone that put together today's meeting. I really appreciate all the information.
Excellent. Thank you, Diana, and thank you for chiming in. I was wondering, I was glad that you did, because I remember I saw your name on the registration process and was looking forward to having you here. So thank you. Thank you for making that phone introduction. We have one other phone caller at 7917, last 4 digits, 7917. Do you want to unmute yourself and just make a quick introduction? And if not, excuse me, and if not, that's okay as well. Give you another few seconds.
I think they need to press *6. It's kind of, I started introducing myself without pressing *6. So.
Okay. So for phone callers, press *6 to unmute yourself. 7917, would you like to do so? And that's all right. We'll keep going. Before we end today, I just want to say, hang in there before you leave. We do have one more thing to get to. We are going to do a raffle for somebody here. A raffle prize. We have a $25 gift card for Starbucks that we're going to be raffling off. So hang in there, and we'll be doing that in just a moment. We're wrapping up our presentation. Are there any other comments about toxic stress, about our referral system 211, or the yes, Mark?
Good morning. Well, I really want to thank you. I'm Mark Thibault from Kern County, and Kendra is a good friend of mine, and she shared your website with me a while back, and I'm really happy to be able to participate today. We recently started our ACEs Aware Network of Care grant, so we're really reaching out to other counties to learn, and you guys are ahead of the curve, and I really appreciate what you're sharing, and I look forward to other meetings. I've shared your links with with our team. And in fact, my co-lead, Hector Gutierrez, shared some upcoming sessions you're going to have for non-providers. And so even though some of these are early morning, it's great information, and the early bird catches the worm, right? So I look forward to getting to know you guys better. So thank you. Great presentations, great information, great organization on this call. Thank you.
Thank you, Mark. I appreciate your comments. And thank you for coming from Kern County. I know we've reached out to Kern County a number of times, and it's good to see some representation here. Thank you so much for sharing that. Glad you are here. Glad you're with us. Yeah. Before we end our presentation today, I wanted to give you a couple additional provider resources. Following on the screen here, we have our ACEs 101. Got your ACE score, ACEs Too High, acesconnection.com, the CDC Kaiser Permanente ACE study, Center for Developing Child at Harvard University, and SAMHSA's Concept of Trauma and Guidance for a Trauma-Informed Approach. All of them are excellent resources. And again, this slide deck is available for those who are interested in getting these lists or watching the presentation again. And finally, a couple upcoming events. We have our Network of Care, our Power of You, which is the third Monday of each month from 2 to 3:30 p.m. Linda, would you like to say something about our upcoming Network of Care session?
Yes, thank you so much, George. We have an upcoming Network of Care session that will be occurring next week, and we really hope to have your attendance. Within this Network of Care, we'll be discussing a very important tool that was shared by ACEs Aware, which is the community assessment tool. This tool has allowed us to identify numerous gaps that we hope to address within our network, as well as establish integrated service of care within the entire Kings County and hopefully Central Valley as well. We hope to gain your attendance in helping boost our service of care network as Lexi and Erica have mentioned in this call. The importance of connecting individuals to services are very vital to help address the impacts of toxic stress and mitigating it. And we hope to include your services as well as provide knowledge on what services are available in our community to you. Thank you.
Wonderful. Wonderful.
So that's
Thank you.
that's on the 19th.
That is correct.
Thank you.
Thank you, Linda. Now we have two additional events coming up this month in April. We have our supplemental training as well as our non-clinical supplemental training. Now there's two important trainings. Our clinical training, our supplemental training, is a 2.5-hour session that does offer CE units. It talks about ACEs, toxic stress, resiliency, screening tool, workflow, and the algorithm. So it's a comprehensive training. We encourage you to check it out. That training is coming up on April 23rd. ACEs and Toxic Stress 101, Kings County. Our non-clinical training is a little bit more tailored for front office staff, for administrative. It's a little bit less on the screening tool and the algorithm itself, and it's a little bit more on behaviors and how toxic stress plays out in the office itself. That non-clinical supplemental training will be held at April 16th. That's from 10 to 12 noon. Both of those trainings are excellent trainings and comprehensive in the coverage of the discussion of ACEs and what ACEs entail. So if you are interested in that, either registering for the supplemental or the non-clinical training, you can go to KPFP's, you know what, we'll put that in the chat feature. Karina, if you could put the ACEs Aware webpage in the chat feature so you can register for our supplemental training or our non-clinical training. And finally, we have a raffle. We have come to that point in the presentation today. If you are still here, your name is in the raffle prize. I'm going to stop sharing my screen, hand this over to Cameron, who is doing the raffle share. There you go. And we're going to go ahead and spin the wheel and see who wins the prize. $25 gift card. And this goes to Mark. You are here. Mark Thibault, you have just won a $25 Starbucks gift card.
I will be very, very happy if you could give it to somebody else who could really use it. I would appreciate that very, very much.
Are you sure, Mark?
I am very sure. Thank you.
All right. Okay, Cameron, can we do one more spin? All right, let's
Not that I don't like coffee, but
and we have it to Patty Haver. Patty, you are another winner. Patty.
George, like Mark, I've won this, and I like other people to have a chance.
Yeah, I love it. Thank you, Patty. So, Patty, you want to go ahead and offer this up again?
Yes, have somebody else win it. I'm so coffeed out from the past that I like somebody else to win.
All right, excellent. One more time. Let's see who we can get. Who is left? We have Tracy and Diana. And let's try it one more time. We can actually hit remove.
May I just select somebody just above me, Tracy?
Tracy, all right. You can go ahead and give it to Tracy. All right,
Wow.
Tracy, you have won a $25 Starbucks gift card.
And I will say thank you. And I feel like I should pass it on to someone else, but I know quite but I know quite a few young people. Yes, I know quite a few people who would really appreciate it. So I will be giving it forward.
Oh,
Yeah.
great.
Thank you.
Great.
Excellent. Thank you, everybody. Thank you all for being here today and for joining us on this informative presentation about toxic stress and how to reduce toxic stress via referrals and 211 and the Kings Referral Exchange. Great stuff today. We encourage you to join us later for our Network of Care meeting, which is coming up in a couple weeks. And again, if you are interested in registering for the supplemental training or the non-clinical training, please go to the website and register. That should be in the chat feature. Thank you so much, Karina and Cameron and everybody here, Linda and Alexi and Erica, who all put forth a ton of effort in making this presentation happen. I want to thank all of you. And I hope that you have a wonderful rest of the day and a great weekend coming up.